Our team, welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. We got our celebrity crew back with us today. We'll do a quick round of introductions, but today we're going to talk all about Sermorelin. It's probably one of the hottest peptides outside of the GLP medications, especially in our practice. You know, we hear a lot of patients talking about, muscle mass loss while they're on their weight loss revolution, weight loss journey stuff. Peptides be kind of a hot topic, and I know we got another episode, kind of defining what peptides really are, but really want to dive into Sermorelin just because it's probably one of the most popular outside of weight loss. But before we do that, let's go around the horn here. Dr. Chang, quick introduction.
Yeah, very good. Kevin Chang, internal medicine physician, and I help to lead our wellness program.
Gilberto?
Yeah, Gilbert Science, physician assistant extraordinaire. Been with the practice about 3 years, and I do a little bit of everything. I've assisted with surgeries before. I'm part of the wellness team and do some aesthetic treatments with the med spa.
Awesome. PA Joe?
Yeah, PA Joe, Joseph Rubio, kind of a background in emergency medicine, doing a lot of wellness with the practice, primarily based out of San Antonio, and the other half of Jobert for those of you out there.
Well, let's jump right into it because I really want to cover a little bit of ground here. And so when we talk about Sermorelin and one of the peptides, it's really coming to fruition. It's not a new medication. It's been around a long time. Actually used initially to treat children who were growth hormone deficient. And so definitely something safe, something that's been around for a while, but really hit a lot of headlines because with the weight loss revolution, a lot of people started talking about muscle mass loss, and topic for another thing. But with significant weight loss, that's not unique to just GLPs that people lose a little bit of muscle mass stuff. But Dr. Chang, maybe talk to us a little bit about what Sermorelin actually does and why it's been so critical and why people have integrated it, some at the start, some at the beginning, and then we'll get into it from my perspective. We've even started using this to kind of for pre-treatment when people are doing surgery, and then for kind of doing that recovery area.
Yeah, you're exactly right. So it's been kind of a cool topic actually, and for at least from my standpoint, probably for these guys as well, the conversation's been pretty natural and organic. As you've already mentioned, when people are losing weight, like for example with either semaglutide or tirzepatide, it's common and relatively normal for there to be some amount of muscle loss along with that weight, right? And as you already mentioned, that's not unique or specific to GLP-1 weight loss, but with any amount of weight loss, really. So Sermorelin has really entered that part of the discussion pretty naturally. And so basically, in essence, what it does is it's a peptide that stimulates your body's natural growth hormone production. I believe that's out of the pituitary gland. And in essence, all the positive effects then come from that part of the mechanism. We see some better, for example, energy, metabolism, muscle recovery, muscle building, muscle toning, etc. And so it's a nice way to complement systemic weight loss. And, as we kind of are often counseling our patients, well, if you're going to lose weight, of course, we preferentially want to lose fat weight, but that can't always happen. So you might want to pair this, or at least consider pairing it with something like a Sermorelin, right? Where you can then help retain your muscle tone and so forth. So that's kind of the major stuff I think that happens, at least in the start with the Sermorelin.
One of the things that made me so excited about it is that, you're not suppressing necessarily your own production of this, because it's actually a stimulator that stimulates you to produce your own. And sometimes people are worried when they're supplementing outside hormone stuff that you're going to suppress your own drive. And that's not true for this medication, which is unique. Exactly.
Yeah. At a very high level, I mean, our hormone pathways are somewhat complex in the sense that there's lots of feedback mechanisms and lots of feedback loops. But you're exactly right. I think with Sermorelin, it's just stimulating what your body's already making. So there's really no quote unquote suppression effect of anything natural.
PHO, the other thing that I think has made this so widely accepted, and I'll tell you personally, I've been on Sermorelin. I started with the injectable. When we started offering the nasal spray stuff, it was a game changer for me because it was hard to do an injection every day. Once a week, I don't mind. Every day is a little bit challenging. So kudos to all our type 1 diabetics out there, insulin stuff. Gave me a new appreciation for that. But there's actually a couple options of how people want to take Sermorelin, and that's been, I think, opening for patients.
Yeah, so we're really excited. Our practice now offers kind of the intranasal version as well. So it's as quick as you would do like, your Zyrtec or your Flonase, allergy mist. And it's nice. It's more convenient. You don't have to worry about traveling with the needles. It makes this a lot more accessible to patients. The goal is to help patients be as healthy as possible and to kind of help them live, taking your words, their fit and fabulous lifestyle. But we also want to make sure that it's easy on them. So it's something that's doable. If you have to line out and make this whole big process process and you have to follow this regimen every single day, that can be very tedious. Doing nasal sprays is not bad at all, and so by doing this, we give the patient the opportunity to use these peptides and live their best, most healthy lifestyle, but in a way that suits them and their already busy life.
Yeah, when do you recommend this, or who have you been treating with Sermorelin?
So I bring it up with every one of our weight loss patients because I think it's important for them to at least know that this is something that is an option and something that they may need to at some point consider as part of their weight loss journey. But I think it's beneficial for a lot of different patient types, not just our weight loss patients. I think there's a lot of different added benefits that patients can get from this outside of just lean muscle mass. And some of those have been linked to much better sleep, more restful sleep, as well as, better cognition, less of like that foggy brain kind of sensation. So I think it's a great option for a lot of different patient types.
I'll tell you, since I've personally started, it has improved my sleep pretty dramatically, and I that's one thing that I saw right away with both of them. I think it's important to note with the intranasal, most likely it's going to take you a little bit longer to get an effect than with the injection stuff. But as we tell most of our patients, this is a journey. We're making a transition, and I hope people see it here that we've really changed this. So it's basically our concept that we've developed, and we're going to talk a lot more about it. This biohacking beyond beauty, because the idea is this overall wellness wave that we're creating. And that's why we call it Beyond the Weight Loss Revolution, because we're just trying to make them, live their best life, all the little things that go into this. So, it's good sleep, it's increasing your muscle tone, it's getting your health stuff. We'll get into in another episode of all the new things that the GLP medications have done beyond weight loss, which is a great topic for maybe our future thing. Because we recently co-authored a paper that talked about the 6 things that GLPs do beyond weight loss stuff. But I think Sermorelin's just been one step in the peptides and kind of introducing that world. Any other big take homes about Sermorelin itself that you guys would love our listeners to take home with?
Yeah. No, I mean, I love it. It's been great. Really, I think very successful. The conversation's been good. We've had plenty of lots of really good success with it. As you've already mentioned, several of our staff members have tried it. I've tried it myself and still use it. And so it's been great. I think just at a high level, most of the things that we think about in the realm of how do we approach a certain kind of therapy, it's usually about a risk versus benefit kind of a equation and conversation, and I think we've just clearly we've just seen lots of really nice benefits with the Sermorelin.
There's no really right or wrong time to start this, right? Because you can start at the beginning of your weight loss journey, in between when you switch to a maintenance phase, or just if you've kind of switched to hey, I'm at a great weight now, I just want to work on my Pilates bodies.
Exactly. I've done it in conjunction either with the GLP-1s, I've done it separately, I've done it pre and post. And as you've already mentioned, I think we're looking at other avenues, for example, around the surgical period or peri-procedural period.
That was going to be my take-home nugget is, for surgery. So we've actually, at the pre-op, right at that month point, gotten a lot of our patients started on Sermorelin, which I think is absolutely fabulous, and then have them do it for about 3 months afterwards until they're completely healed. Some patients just love it and want to continue doing it, but, a lot of people, this is investment in their time, health, so forth. And so any little things that they can do to get to a great spot, especially since a lot of our patients having surgery have been on their weight loss journey, it is a little bit of an impact on the body to kind of reset. And so anything that we can do to help them recover. And I don't think people realize, how much of a toll surgery does take on our bodies. And even if the incisions are fine and great, it's still recovery time.
Yeah, absolutely.
Gilbert?
I think again, just to kind of reiterate what I said earlier is, this is an opportunity for patients to really just work on their wellness from all aspects, not just from their weight loss journey. So I think it's something that, anyone who's interested in the other benefits of this peptide, should certainly inquire about it, because we're always happy to discuss it.
Yeah, Joe, any take home?
Yeah, just to kind of tag along to Gilbert there, one of those other benefits that I love, with my background is the improved bone mineral density. Mm-hmm. It's an ongoing battle. Anybody over the age of 65 versus a ground level fall. And those are things where you have, these subtle hip fractures, these subtle, humerus fractures. And by improving that bone mineral density, it's muscle's great and that can be lasting. But, you're preventing yourself down the road from these injuries that are harder to recover from as you age. And so I think it's an amazing thing. I think it's really going to change lives, not just today, but in the future.
And you're going to see us incorporating more of this at different times as we launched our biohacking program thing. You're going to see this, incorporated with pre-procedures for people having surgeries. I think overall being able to now really hone in and where people are from a hormone, from a different standpoint. I think there's a lot of things that play into living your fit and fabulous life. So really cool that this is another, tool that people can use to just get to their best spot, especially when they feel like they've stalled out a little bit. So appreciate you guys dropping this. We're going to try and do more podcasts like this that are hyper-focused on a specific question that we've gotten from all of our patients. So Sermorelin, one of the hottest peptides, definitely in our practice, but really throughout the United States, you've seen a lot of this. Stay tuned. A lot more to come your way. Plastic Surgery Untold, the greatest podcast in the world. Download us anywhere you get your favorite podcasts, iHeart, Spotify, Pandora. And if you want to see us, you can check us out on YouTube. All right. We'll see you guys soon.